Good evening, Miss Brown. This is my audience, my grandma, so excuse me if she holds the camera kind of wrong. Okay, so hold it this way now. Hi, my name is Lakin Smith, and today I will be talking to you guys about how not to mistreat prescription drugs. Did you know that prescription drugs are the leading cause of fatal overdose? Over 12,000 Americans are hospitalized each year for overdosing on painkillers. And did you know that prescription drug abuse kills more people than traffic accidents? Mayo Clinic published an article that states an increasing problem. Prescription drugs abuse can affect all age groups, but it's more common in young people. The prescription drugs most often abused include opioid, painkillers, and anti-anxiety medications, and stimulants. Going to school to become a pharmacist, I think it's important for us to know the drug dosages, usages, and side effects. Being aware of the usage, dosages, and side effects of Norco or hydrocodone. When taking it or any painkiller, it will help lower the chances of becoming addicted. I will discuss the usages, then I will move on to the dosages and side effects. Hydrocodone is an opioid pain medication. An opioid is sometimes called a narcotic. Hydro-ER and high-single-ER are extended release forms of hydrocodone that are used for around-the-clock treatment of severe pain. Extended release hydrocodone is not for use on an as-needed basis for pain. Follow all directions on your prescription label. Hydrocodone can slow or stop your breathing, especially when you start using this medication or whenever your dose is changed. Never use hydrocodone in large amounts or for longer than prescribed. Tell your doctor if the medication seems to stop working as well in relieving your pain. Hydrocodone may be habit forming even at regular doses. Never share this medication with any person, especially someone with a history of drug abuse or addiction. Narcotic medications can cause addiction, overdose, especially in a child or any other person using this medication without a prescription. Selling or giving away hydrocodone is against the law. Your dose needs may be different if you have recently used a similar opioid pain medication and your body is tolerant to it. Talk with your doctor if you are not sure you are opioid tolerant. People living in today's society must be aware about the dangerous usages of Norco or any prescription drug can have on them or the people around them if they're not taking them correctly or using them to its advantage. Next, I will talk about the dosages, then side effects. The usual adult dosage of Norco 5-325 is 1 tablet every 4 to 6 hours is needed for pain. The total daily dosage should not exceed 6 tablets. Norco 5-325 may interact with other narcotic pain medications, sedatives, tranquilizers, sleeping pills, muscle relaxers, or medications, or any other medications that can make you sleepy or slow your breathing. Lastly, I will discuss the side effects of Norco. The most frequently reported adverse reactions are lightheadedness, dizziness, nausea, and vomiting. These effects seem to be more prominent in ambulatory than in no-ambulatory patients, and some of these adverse reactions may be elevated if the patient lies down. It is not recommended for use in children younger than 6 years due to an increased risk of side effects, such as slow, shallow breathing. As I stated above, it can cause things such as drowsiness, upset stomach, constipation, headache, mood change, blurred vision, ringing in your ears, or dry mouth. Now that I have discussed these dosages and usage and effects, I hope you all have a better understanding of this drug or any drug, and knowing how to not mistreat prescription drugs can save lives.